Welcome to Medico concept. Today topic is about spinal cord. I try to make it this concept is very simplified. Okay, first we have a 33 vertebra, but we have only 31 pair of spinal cord segments. See, we have a 7 cervical vertebra and 12 thoracic vertebra and 5 lumbar, 5 sacrum and coccyx. These are all we have a 33 vertebra, but we have a 31 pair of spinal cord segments. Now coming to adult spinal cord. It's about 45 centimeter long. We have a 45 centimeter long organs in our body. That's all thoracic duct and femur and uh, something one also. And it have a only half inch. That means 15 width. The central nervous system tissue ends between vertebra L1 and L2. At birth, the cord and vertebrae are about the same size, but the cord stops elongating at around age 4. Already I said 31 segments, so we have a 31 pair of spinal nerves. Each pair of nerve exists the vertebral column at the level it initially lined up with at birth. And coming to spinal cord segments, we have a 7 cervical vertebra, but here 8 cervical spinal segments have based on vertebrae where spinal nerves originate, and positions of spinal segments and vertebra change with age. So the position of spinal segment is changed with age. Okay, and spinal nerve are originally lined up with the exit point from the cord. And next, even after the vertebral column grows much longer, each pair of spinal nerves still exists at its original location, now several segments away. Okay, and coming to function of spinal cord, it acts as a pathway for motor information and sensory information and center of simple reflex. Motor information means which travel down the spinal cord. Okay, in sensory information is reverse direction, it's upwards. Okay, and coming to external features of spinal cord, it have fissure and sulci, I'll tell you later, and attachment of spinal nerve and its enlargement and cauda equina. What is cauda equina? I'll tell it here coming class. And now I'll just show. See, this is the anterior part and this is the posterior one. Oh, the butterfly or H shaped is called gray matter, and this is white matter. And anteriorly, you have a anterior median fissure. Fissure means narrow, deep. Okay, that means. And posteriorly, you have a posterior median sulcus. One thing you must mind it, anterior median fissure is only one, that is anterior median, and sulcus is lot of sulcus, I'll tell you later. Posterior median sulcus is posteriorly, and posterior lateral sulcus, there are here two pair of posterior lateral sulcus. Here is a here one sulcus, that's a anterolateral sulcus. Here is also anterolateral in sulcus. That's it. Here central is called central canal. Central canal is filled with cerebrospinal fluid. And transverse section of spinal cord. Here see cervical and lumbar. These two regions are enlarged due to it gives nerve fibers to upper limb and it gives fibers to lower limb. So it's enlarged in shape. Here you can see it here. This is a dissection of spinal cord. Okay. Now coming to the spinal cord starts from C1 and ends in lower border of L1. Okay, the lower border of L1, that is distal end. Distal end have a 3. That means distal end is end with conus medullaris and cauda equina and phylum terminale. Now you can clearly understand the distal end. Distal end is 3. One is conus medullaris and cauda equina and phylum terminale. Conus medullaris is thin cortical end of the spinal cord. See, this is a conus medullaris and cauda equina. Cauda means tail and equina means horse. So the cauda equina means tail of horse. How the tail of horse is arranged like that? The cauda equina also arranged in spinal cord. Nerve roots extending below the corna medullaris. This is a below the corna medullaris. And phylum terminale. This is a thin thread of fibrous tissue at end of conus medullaris and also attaches to coccygeal ligament. Okay. See, clearly you can understand here. This is corna medullaris and this is cauda equina and this is terminale, phylum terminale. Okay. And now spinal meninges. That means what are the coverings around the spinal cord? Okay. Specialized membranes isolate spinal cord from surroundings and spinal meninges are protect spinal cord and it carry a blood supply and continues with cranial meninges. See here meninges, outer layer is dura and middle layer is arachnoid membrane and inner layer is pia mater. This is also same as in the brain. Okay. Now spinal dura mater. See, these are tough and fibrous, cranially fused with periosteum of occipital bone, continuous with cranial dura mater, and caudally tapers to ends dense cord of collagen fiber and joins phylum terminale in coccygeal ligament. We already seen. Okay. In epidural space means a space between the dura mater and wall of the vertebral canal. Okay. No such space in the brain, but in brain we have a dome that space. It contains loose connective tissue and adipose tissue. If we have any given anesthesia drug, each injection site is epidural space. And coming to interlayer spaces just like in the brain. Okay, we have a subdural space, subarachnoid space and spinal tap. Subdural space between arachnoid matter and dura mater. Subarachnoid space between arachnoid matter and pia mater filled with cerebrospinal fluid and a tap withdraw cerebrospinal fluid from inferior lumbar region for diagnostic purpose. That means lumbar puncture. That name is lumbar puncture. And coming to modification of pia mater. Here diameter, அதாவது that means end of the spinal cord, that's diameter is modified. That's all ligamentum denticulatum and linea splendens and phylum terminale. Ligamentum denticulatum have a 21 pair. Denticulatum means teeth-like projections. It keeps the spinal cord in position. Okay. Linea splendens, thickening seen in the anterior median sulcus. Phylum terminale is 20 centimeter long. Okay. The diameter modifications are seen in terminal part of the spinal cord. That means it's in L2 vertebra. Okay. General features of spinal cord. Generally, we are what are all seen in spinal cord. Is a narrow fluid filled called central canal. Central canal is surrounded by butterfly H shape, that's gray matter. It's containing sensory and motor, unmyelinated process and neuroganglia. In white matter, outside of the gray matter is white matter and contains myelinated and unmyelinated fibers. And coming to some features. Spinal cord ends at lower border of L1, already known. Spinal dura ends at S2 and spinal arachnoid ends at S2 and spinal pia ends at C1, lumbar puncture L3 and L4. Here some external and internal features. If we take this white matter, that means this in white matter, we'd have a anterior, lateral and posterior funicles. Okay. If we take a gray matter, if we take the green matter, that's a butterfly or H shaped. Okay. Gray matter, it have a anterior, posterior and lateral horns. Okay. That means white matter is called funiculus, gray matter is called horns. Okay, that's all. And coming to generally what a rule, that is the rule is sensory roots and sensory ganglia are dorsal. Dorsal means posterior. That motor roots and motor nuclei are ventral. That means anterior side. Okay. Anteriorly motor roots and posteriorly we have a sensory roots. That's all guys today's topic. If you have any doubt, please comment in comment section. I'll try to make this video again in Tamil also. Thank you guys.